Today we are going to review the basics of ABGs and interpreting them. So first, let's always go over our normals. So our normal pH is 7.35 to 7.45. Our normal PaCO2 should be 35 to 45. Our normal bicarb should be 22 to 26. And our normal PaO2 should be 80 to 100. So it's always important to know your normals before you start fixing the ABG or interpreting it. So with pH, a lower number is going to be acidic. So we're going to put an A up here for acidic. On PaCO2, remember anything above 45 is going to be acidic. For bicarb, below 22 is going to be acidic. And then basic, it's going to be alkalotic above 7.45. Below 35 is going to be considered an alkalosis for PaCO2. And above 26 is going to be considered alkalotic for bicarb. Let's talk about interpreting the ABGs. So when you see them, you're going to see pH, and then you're going to have your PaCO2, and then your PaO2, and your bicarb. So let's practice one and we'll go through step by step. So let's say our pH is 7.23, our CO2 is 57, our oxygen is 81, and our bicarb is 24. So the first thing that you are going to look at is your acid-base status. So the acid-base status looks at the pH, and 7.23 would be an acidosis. So you've determined that the acid-base status. So now you're going to look at the ventilatory status and you're going to look at the PaCO2, which is also acidotic. From there, you're going to look at your metabolic status, so your bicarb, and you can see that it's normal. And last, you look at your oxygenation status. So 81 is still within normal limits. So because the body hasn't compensated, so you can see the pH is acidotic, and so is the CO2, but the metabolic status is still normal. So the body hasn't had a chance to compensate. So that would make it acute because the body hasn't worked to change anything. So it's acute. And acute is also known as uncompensated. And we look, okay, so we know it's acute. There's only two numbers that are off, which would be the pH and the CO2 in this case. So because the CO2 is causing the acidity, so we are going to name it respiratory because it's a respiratory reason. So acute respiratory, and it's acidic. So we're going to say acidosis. And then you look at the oxygen and you would say with normal oxygenation. Let's work through another one. So you can see here, we're going to assess our acid-base status, and we can see that it's alkalotic. So I'm going to put a B for base. Then we're going to assess our ventilatory status, and we can see that it has a decreased PaCO2, so it as well is alkalotic. Then we're going to skip over the oxygen status for now and go to the metabolic side, and we're checking our metabolic status. Well, it's still within normal limits. Still within normal limits. So now we're going back to our oxygenation, and that is within normal limits. So now we are going to interpret our ABG. So looking at our ABG, we can see that only one of the numbers have changed, only CO2 has changed, and that the bicarb has not moved at all. It's still within normal limits. So we know it's an acute problem, and because it was CO2 that changed, it's an acute respiratory. And because it's went to the alkalotic side, it's an acute respiratory alkalosis. The oxygenation status is normal, so it's with normal oxygenation. Let's do another one. So evaluating our acid-base status, so 7.20 would be acidic. And then we're going to assess our ventilatory status, which is 22. So we know that that is on the base side. And then we're going to go over and assess our bicarb, and that as well is acidic. Then we're going to look at our oxygenation, which is still within normal limits. So interpreting this one, we can see that all three values, pH, CO2, and bicarb, have changed. So we know that because the pH is not normal yet, that it's partially compensated. And we are going to look which value matches the pH. So in this case, the bicarb matches the same value as the pH. They are both acidic, whereas CO2 is on the alkalotic side. So it's a partially compensated metabolic acidosis. I cannot spell today. And then we're going to put in the oxygen, so with normal oxygenation. Let's interpret this one. So the first step, remember acid-base status, this pH is normal, so it's within normal limits. So now we are going to look at CO2. So our CO2 is a little elevated, a lot elevated. So acidic, then we're going to go over to bicarb, which is elevated as well, so it's more alkalotic. And our oxygenation is still within normal limits. So when we interpret this one, we're going to look at the pH status. It's within normal limits. And because we know that the other two values are off, we know that it's compensated. So it's compensated. Or it could also be called chronic. This would be an example of your COPDers. So it's compensated or chronic. And because it's closer to 7.35 and below on that side of the scale, then it is going to be a chronic respiratory acidosis with normal oxygenation. We are also going to go over the levels of hypoxemia. So we know that normal is 80 to 100. So we know that 60 to 79 would be mild hypoxemia, and then 40 to 59 would be moderate, and severe would be anything that is less than 40. Remember that in Colorado, we're at a higher elevation. So normal oxygenation, anything over 60 may be, and it all depends on looking at the patient. Are they from Colorado? Are they here traveling? So anything above 60, a lot of physicians aren't going to worry about because we are at that higher elevation. But the NBRC hospital, or I like to call it the unicorn hospital, where everything's perfect, for your boards, normal is 80 to 100. Okay, so we're going to talk about corrected oxygen levels. So this is if the patient is on oxygen. So if the patient is on oxygen and it is greater than 100, it is overcorrected. If it is 80 to 100, it is corrected. And then if it is less than 80, it's going to be uncorrected. So before we get into the rules of fixing an ABG, we're going over this again in so much detail because when we get into non-invasive ventilation, like BiPAP and CPAP, which is our next section, it's going to be important and we are going to be looking at ABGs. So I wanted to do that quick refresher. So rules for fixing the ABG. So number one, we're going to fix respiratory acidosis first. Okay, but this is going to be with the exception of permissive hypercapnia. So permissive hypercapnia would be just a little bit over normal, a little bit acidic. And that is when a physician might say, okay, well, they are at 49 and I'm okay with that. Maybe they had just gotten diagnosed with a chronic lung disease. And so we know that they're going to be a little bit higher. That's okay. Number two, then we're going to look at hypoxemia. We want to fix the respiratory acidosis and then the hypoxemia. If they are in a respiratory alkalosis, if they're in the respiratory alkalosis, we'll fix hypoxemia and then focus on the respiratory alkalosis. And then the last thing that we would fix on an ABG is hyperoxia. So let's do a couple practice ones. So let's say this is 7.25, and this is 53, and this is 63, and then this is, say, 24. So first we're going to look at that acid-base status, and we can tell by the pH that this patient would be acidotic. Then we're going to look at our ventilatory status, and this too is acidotic. Then we're going to skip the PaO2 and go to the bicarb, which is normal. And now we're going to go look at the oxygen status, so 63. So at the Unicorn Hospital, this patient would have mild hypoxemia. So let's go back and name it. So it is, because the bicarb is normal, it would be an acute respiratory acidosis with mild hypoxemia. Okay, let's do another one. So let's say that this is okay. So let's start by looking at our pH at the acid-base status. So the pH is basic, it's alkalotic. Then we're going to look at our ventilatory status, and we can see that it is decreased. So it is also alkalotic. And then we're going to look at the bicarb, and it is also increased. So it is also alkalotic. So this is something that we didn't go over earlier. So if you see this, this is a mixed. This would be a mixed blood gas because they are both the same, mixed or combined. Either one's fine. Okay, and then we're going to look at the oxygenation status. So that is mild. So the overall interpretation would be mixed or combined alkalosis with mild hypoxemia. All right, let's do one more. So let's do this. Okay, so let's start with our acid-base balance or status. So acid-base status, we can see by the pH that it's acidic. And then we're going to look at the ventilatory status, which is below normal, so alkalosis or basic. We're going to skip PaO2 and go look at our bicarb, which is also low, so it's also acidic as well. So now we're going to go look, and let's say that this patient is on 2 liters nasal cannula. So let's look at our oxygen. So it's not in that 80 to 100 range, so it is not corrected. So it's decreased. So when we name this ABG, we are going to say that because both CO2 and the bicarb have changed to opposite, one's acidotic and one's alkalotic, we're going to say it's partially compensated. And the pH tells us that it's an acidosis, so we're going to match it with the bicarb. So it's a partially compensated metabolic acidosis. Oops. And the oxygen status, they're on 2 liters nasal cannula. So we know that we're trying to correct it, and it's an uncorrected hypoxemia. So So make sure that you're always practicing these. This is something that we will always deal with and always have to interpret and change our treatments for the patients depending on ABG. So it's good to always practice and refresh yourself if you haven't done them for a while. So if that being said, so if I give you the worksheet, when I give you the worksheet, if I don't say that they're on oxygen, just assume that they are on room air. I will tell you if the patient is on oxygen. And let me know if you have any questions.